Hello and welcome to As Pharmacist Tish. This is my very first episode. I am so excited and I appreciate everyone who will be watching the replay for watching. And please leave a comment in the comment section to let me know that you're here. So first off, I want to start off with Happy Valentine's Day, the day of love. And of course, you know that love is very healthy. So I hope y'all having a great Valentine's Day and y'all did something really special for that special someone. So either way, I appreciate everyone who was here and everyone who will be watching the replay. Remember to like, share, and subscribe, and I will be greatly appreciative. So let's get started. My name is Tish. I am a pharmacist for over 20 years, and I am here as your personal online community pharmacist. So, as I said, I've been a pharmacist for over 20 years. I've been working in a pharmacy since the age of 16 years old. So, I was a young technician, and I just have so much knowledge to give, and just from regular vitamins to supplements to vaginal health, just whatever your needs are, a pharmacist like myself will be able to help you out. So, why is it so important and so great to have a pharmacist that has your back, that is in your corner? Well, first of all, pharmacists have like a wide array of medical information to start off with. Yes, you can Google. Yes, you can, talk to family and friends, but the most important thing is the kind of information you're getting. So we are trained to give medical advice, and just help out the whole family structure, from your little baby that needs Tylenol to your grandmother that needs help with her diabetic medication. So, um, give me a moment. My music is a little bit too loud in my headphones, so I think I'm gonna tone that down because I can't really hear what I'm doing. So that's the beauty of live. You got to be a part of every single thing. And I can't really see where the music is. But either way, like I said, I'm a pharmacist for over 20 years. I am also a mother. I have one beautiful daughter that goes to Chapel Hill, and I am also a mom to two fur babies. So, all of you in the community that have animals and stuff like that, a pharmacist can actually also help with your fur baby needs. Not too detailed, of course, like a veterinarian, but we can kind of give you some kind of help when you're in between visits with your veterinarian or some kind of emergency event. We can give some kind of advice. So, what does a pharmacist do? So, we basically do more than just sling pills in a bottle, which is the rumor, but we also have expanded our resources. Thank you so much. Thank you. That helped out so much. The music is cut down low, so I was probably just babbling. But we're part of the whole healthcare system where everything is more so with medication these days. Like long time ago, a lot of things were taken care of invasive wise, meaning you had to do some type of procedure or surgery. But the beauty of medicine now that it has grown and the technology is so brilliant that you can take care of a lot of disease state by taking a single pill. But the danger of that can be is a lot of times if you go to different pharmacies, if you go to different doctors, a lot of things can go wrong and your medications can be duplicated. Drug interactions can occur, and just basically life threatening issues can occur. So, besides putting pills in a bottle, we are a comprehensive profession where we overlook all of your healthcare needs and your medication needs and to prevent anything from going wrong. So, like I said, I'm your personal online community pharmacist. And it's just great to have that because we are very accessible. We are a free resource. there is probably a pharmacy at every corner in the United States. And you cannot have a pharmacy without a pharmacist. That is not legal. And that's not going to be the case. So we are very accessible versus a doctor's office. You have to make appointments. It's not as easily accessible. So a lot of times we are the front line to healthcare. And we also the back end of healthcare because once you do need help, or if you do go to the doctor, then we're the ones that fill your prescriptions for you and give you that consultation, the medical advice to make sure you're compliant and everything goes smoothly. So we're here to help out now with your health, with your self care. And what I mean by self care is you have a responsibility, or how do I want to word it? You're more everyone's more accountable these days for your own health care, which is a beautiful thing. Like I said, because of the internet and online services and stuff of that nature, there is so much information out there. It could get very confusing, very convoluted, but we are here to make sure that everything is straightened out. And this the beauty of the accessibility is everything. But not only that, as Pharmacist Tish is a mom and a pharmacist, I am also a nonprofit in my own right. And my platform is basically educating to improve healthy outcomes, but is more so niched down to health disparities. That is so very important to me because from all of the years I've been in pharmacy, I've seen the ways prescriptions been written. I've seen, the issues of certain minority groups, just from seeing how, like I said, how prescriptions are written, the best care is not given, unfortunately, to minority groups. So it's very important to me to be a part of the process to end health disparities. So basically, what is racial health disparities? And the answer to that is health disparities are the inequalities that occur in the provision of healthcare and access to healthcare across different racial, ethnic, and socioeconomic groups. So the main words are provision of healthcare. Unfortunately, we all human, and if you already have a preconceived notion about a racial group, or just ideations of certain people, and then that may influence or prejudice the way they take care of you. Another big word with that is access to care. Like I listened to before, one doctor mentioned that the where we live is the secret sauce of health disparities. If you don't live in a neighborhood that is in the right zip code, your access is going to be influenced, and that's going to affect the overall health care of you and your family. But as a pharmacy, as a pharmacist, like I said, because of big pharma and how medications are a big deal, you can always access a pharmacist, and we are a free resource. So, with that being said, what can we treat, or not treat per se, but what can we look over and take care of for you and your family when it comes to over the counter care? So, one of the main things we help with, which is going on right now, is cough and cold season. But the tricky thing with that is there is the COVID-19 that's going on. So, a lot of the symptoms of a basic cold or allergies may mimic the COVID. So definitely, pharmacists, we are very careful on making sure that we don't overstep, because we do recommend that you see your medical doctor in cases such as that. But in usual circumstances, we help with cough and cold. Nothing annoys me more as a pharmacist to see someone wasted their time and wasted their money to go to the doctor just to get a simple, like, cough and cold medication. Like literally, the cost is super jacked up. Is literally something that you can get over the counter for such disease states, and it really just it um don't care for it. Hey, trash can waves, how are you doing? Oh, thank you for checking it out. He is so funny. Um, and how did you know? But either way, appreciate you. Allergies. We also help with allergy-like symptoms. That's also, like I said, because of the COVID, we are very careful about when it comes to recommendations. But allergies is a big issue that a lot of people go to the doctor for, and literally the doctor will tell you or write a prescription for some Zyrtec or some Claritin, and how much money have you spent on a doctor's visit? How much time have you spent waiting to see said doctor when you could have just come to your accessible local pharmacist? We can, have a discussion, and we can, give you from what you're telling us what will be the best thing for you. So allergy is another big thing that pharmacists can help with that can save you money. Upset stomach. A lot of people have heartburn. We just got out of the Thanksgiving season, the Christmas season. We ate a lot of food, a lot of junk. Today is probably a lot of pastry, a lot of cakes, a lot of romantic foods going on. So tomorrow, maybe some belly aching. That is something where you can come to your local pharmacy, and a pharmacist can have a discussion with you and give a recommendation instead of wasting your time on going to the doctor and spending all that money. But as a pharmacist, we have to also be careful. And with our training, we know the difference between when it's time to give such recommendations or when it's an issue and it may be mimicking, like with women, this is heart month, when it can be mimicking a heart issue. So we are very trained and we're very specialized and careful on our recommendations. We definitely are not trying to replace medical doctors, but doctors in our own right, we are trained for that. Um, Rashes and skin ailments. This is another pet peeve of mine. Oh my gosh, I've seen so many people that go to the doctor for a simple rash and will leave the doctor's office with an expensive cream that is over literally $100, even with insurance. Over $100 for a cream when you can literally come to your local community pharmacist first. We can take a look at it, and if it's something within the confines of our expertise, then we can get you. I've done it millions of times. I've given people creams for like literally under $10, literally, and it worked just as good as the prescription. I promise you. So that's another pet peeve of not mine when I see people go and come from the doctor and not know the beauty of having their own personal community pharmacist or just a pharmacist in general that can save them on time and money. And then, of course, we do like the vitamins if you need energy. My big thing is vitamin D. A lot of people, um, they sleep on vitamin D, but especially with the COVID-19 going on, it really builds up the immune system and gives you that energy. It's just basically sunshine in a bottle. So that is really a good thing for your pharmacist to give recommendations. You can come by, let us know what you need, what you want, and we will be there to give you our expertise on what will be the best vitamin for you. And then, the typical vaginal health, a lot of times that's usually a fire truck emergency. So, we usually don't have any issues with that. I don't really see too many creams coming from the doctor when it comes to vaginal health because it's such a fire truck emergency. Y'all coming beeline to the pharmacy, hobbling over, thighs clenched, needing some cream or whatever like that. So, stuff like of that nature. Y'all men too. Y'all want to know how to get y'all groove back. I've had um a patient. who is 78 years old and have him a little 37-year-old woman, and he was highly interested on how to get his groove back. So as him coming to me, we discussed it. To be honest with you, I think he need a little bit more than an over the counter product. But I helped him out as best I could, but I did give my recommendation that at his age, he probably needed something a little bit more advanced than some ageless male products, or stuff to really get things up and jumping again for his 37-year-old woman. So, and then, smoking cessation, just a whole range of things. What else are we good for? We are good for saving you time, like I said. Going to the doctor for a lot of things really isn't necessary, but if you don't know any different, that's the first thing you're going to do, because as a society, that's what we are trained. And plus, pharmacists role in the healthcare community has expanded, so usually we will save you a lot of time. And if we cannot help you at our level, we will definitely tell you, okay, this is the next step, and you definitely should make a visit with your doctor. Like I already mentioned before, money. I mean, and it's not just because you can come to us and get our expertise for free, which is invaluable. Because I know personally, I've saved people so much money, like so much money. Like I said, with the creams, I had a customer who had a prescription for over $100 cream, and I was able to get them a cream for literally under $10, and they came back to thank me. So we save you money, which is great for the overall healthcare system. Um, so that's the main thing, and it's not just saving money when it comes to over the counter products. When you do have to go to the doctor, a lot of times, if the insurance isn't working properly, or if you don't have insurance, we know little tricks, we know little quirks, we know the discount codes of saving you money. That's the kind of resource that a pharmacist can be. Our goal is to save you time and to save you money and to take care of you and your family. Okay. So back to the health disparities, to tie it in with what a pharmacist, how, can help out with that. The main thing with it is the accessibility. I'm sorry, I still have this up on the screen. Being accessible. If I could get that taken down. Yeah. Okay. So being accessible is very important. And like I said, the zip code of where you live may affect the accessibility to healthcare. So we can definitely, we're, a pharmacy is everywhere. So it's really no excuse for not having proper health care, because a healthcare professional that is properly trained and very well trained is at your disposal. There is a pharmacy at every corner of every place in the United States, just about. Even in some of the rough areas, there's going to be a Walgreens, there's going to be a Walmart somewhere, there's going to be a CVS. So just to know that we are there to help, and that we are trained to help, is a big part of what I want to share with you in the online community. So, why is it important to address the health disparities? Um, the main thing is, when a group of people aren't well, when a group of people are underserved, then that makes America in general underserved. That makes us not as great as we can be. Our healthcare system, as we all know, is a mess. It's overpriced. It's just, is confusing, it's convoluted, and it can definitely be taken care of. Thank you, Teacher Chronicles. Appreciate that. Um, and if y'all have any questions or concerns, try to call the number, or you can come up on the panel, and I'll be glad to share any information, or um, answer any questions. Let me paste here. Um, but yeah, so it's basically health disparities. Let me put it in a way that could be understood. Let's say, and why it affects everyone and not just that group of people that being underserved and who are underprivileged and underserved. Let's say you have an earache. Okay, a ear is just a small part of your um of your body. It's a very important part all the same. But if you have an earache, the whole body is going to be I'm sorry, my mic muted. The whole body is just going to be put down. So that's what health disparities bring. It kind of brings the whole system under you know under siege. The cost of healthcare is just phenomenal. If we were to address the health disparities, the undercurrent prejudices of the doctors, the nurses, I mean, even some pharmacists, sometimes you can come to a pharmacist to get free information, but if they're not in that right frame of mind, they're just going to blow you off and tell you to go to your doctor and you're back at square one. So it's just important in pharmacists, we can help out because we are accessible. That is so important. So it's really, I want to bring attention to is really no excuse to not get proper care. What other things that we can do is we have a way of screenings. We remind you of healthcare screenings that are important, basically with information. We can do blood pressure checks. And if your blood pressure is out of control, we can document that for you and refer you to go and see your doctor. A lot of times people, they know that they have high blood pressure because they can feel it. And once you can feel it, it's pretty much a mess. But if you actually have a healthcare professional to take that diagnosis for you, to show you that number, to show you that your blood pressure is 180 over 90, that's going to give you more of a fire truck emergency to see your doctor, to make that appointment and get it addressed. So, saying or knowing that you have high blood pressure, but having a pharmacist that can actually take that blood pressure for you, that's going to be a totally different concept, and that's going to give a more urgency to take care of your health. Because usually with me, if you come to me and I take your blood pressure, and if your blood pressure is out of check, I'm going to put the fear in God on you. I'm going to let you need to see the doctor, or you may not wake up tomorrow, because sometimes it can be like that. um with men, sometimes y'all hard headed, so I have to scare you. I have to be like, if you keep your blood pressure high, it's your sex is not going your oh, I'm sorry. Sorry, my phone's ringing. The sex drive is going to decline. And usually that's the thing that will get men. With women, we're a little more reasonable with our health because we are the caretakers. And a lot of times we can't take care of other people if we're down and out. So, women, we are a little more reasonable with healthcare, but y'all men, no. So, I have to be realistic and like, listen, if you still want to be functional in every which way, you need to go ahead and get that blood pressure checked out. A lot of concerns would be from men. And I'm picking on the men because y'all do have the hard time. Um, what about if the medications cause difficulties? Let's say with not functioning um, in a proper way with your wife, with your spouse, with your girlfriend, whatever your situation may be. And as a pharmacist, we can reassure you with all the technology and the new medications are out there. There are medications that are less prone to cause difficulties and side effects. So that's another thing where we can kind of dispel some of the not the rumors per se, but the issues that people have with taking medications. Um, so that is a main thing right there. So let me see. So basically, we are just here, and I'm just here to serve you. I am here to help with whatever your medications needs are. I am here to give information. By no way I'm trying to overstep a medical doctor because they are very, very much trained and they are great at what they do. They've gone through a whole lot of school, a lot of boards and everything like that. But with the overall way our healthcare system is going, with the issue of health disparities, which is a public health crisis, uh, pharmacists, we are here to be a part of that solution. So that's why I am here, for that reason. So let's see. The main thing is, I'm just looking at my notes. Is just to basically help with save time and money. That's what a pharmacist can do for you. We can save you on time, because we are basically a walking encyclopedia, a walking WebMD. We are a walking Google, and that's the thing with online services. That's the problem with Google. That's the problem with Bing. That's the problem with any of those research platforms. The issue is so much information that's out there that it can get very convoluted. And how do you know what information to trust? There are so many conflicting information that can oppose each other, and that's what a pharmacist can do. We can guide you to the great resources, or we can dispel some of the things that doesn't make sense on Google. But we are in no way in comparison to Google, as in we are a trusted resource, whereas Google is just so much conflict and resources out there that it can really get you more into a mess and make your healthcare worse than just coming to your local health, community pharmacist. So that's the main thing with that. And then money, like I mentioned before, health, prescriptions, they aren't cheap. I'm not cheap. I'll be honest with you, I still work in a pharmacy and I am not cheap. You have to pay for my services. You have to pay for the drugs. And, my administration fee is in the mix of that. But we do understand that the healthcare system is aggressive when it comes to payment. A lot of it's heartbreaking to see a lot of people that have to walk away because they cannot get their medications. But we are a resource. We can easily, like, you have a, let's say you have a blood pressure medication, and it's super expensive. We can easily find you a discount, or we can contact your doctor and say, hey, can we find a cost effective solution, for a cost effective solution that, and a different drug for this patient? That's what I do all day long. And you have to really find a really caring pharmacist to do that, because it is a pain in the butt and it is a lot of work. But also on this platform, you can contact me privately. I have a HIPAA secured website where I can talk to you, and it's HIPAA secured. And if you have any questions about your medications or whatnot, I can definitely direct you on, is it a good fit? Is there a cheaper option? Because it's better to work on finding an option that will be cost effective for you than having no options whatsoever. So we are very, very good for that. We are very, very good for calling the insurance company on your behalf. Is a lot of issues with insurance companies don't want to pay for medications. Hey Jessica, how you doing, girl? um, there are a lot of medications that are pricey, and or needs what they call a prior authorization. So that's something that we can call on. And Jessica here, she is like the bomb technician. We work together, and she's just awesome. So Jessica, if you have any input or anything, please type it, or you want to come up on a panel and talk about it. If you want to have pharmacy stories, definitely join me. But Teacher Chronicles asks, how many hours do I work? Um, the typical. I'm not really full time, but I do a 72-hour per pay period. So it's not the 80 typical 40 hours per week. So I think it's like what 36 hours a week, but just enough that um that the job gets done. Yes, pharmacy stories. Woo, I got a lot of those. I'm gonna get to one of them. I'm gonna start the first one off with a bang. So many good manufacturer coupons, especially on insulin pens, that help so much. Yes, that is so true. And Jessica was amazing for finding those insulin coupons because it's just really sad. And I know you can agree, Jessica, how so many people have diabetes, but the medications is almost impossible. As a pharmacist, I wouldn't be able. I would understand how I would pay for that stuff every month, but when you find a really good caring team and you're a pharmacist, since Jessica here, let me cut the crap. I ain't doing nothing. It's really the technician. I'm just joking. But when you're a good pharmacist, you have a great staff. They're relaxed, they're working at their full potential, and they will take the time to really get those cost savings for you. So, like I said, it's really no excuse for not being on top of your healthcare because you can literally go to your local pharmacy, go to your pharmacist, and we will definitely help out with that. So let me see. So yeah, like Jessica said, so many good manufacturer coupons, especially insulin pens that help so much. So yeah. So as for our pharmacy story, um, I've been working in a pharmacy since I've been 16 years old. So I have a ton of, but I think by far, and I'm not sure if you know this, Jessica. I think I probably mentioned it to you before, how I was working in this really, I'll put it nicely, underserved and underprivileged community pharmacy. And it was 9 o'clock in the morning when we opened. And as soon as we opened, we had two customers that were waiting, a husband and wife, boyfriend, girlfriend. I'm not sure what the dynamic is. It doesn't matter. And so they was like to my technician, we need to talk to a pharmacist. Okay, it's 9 o'clock in the morning. I'm not a morning person. I'm working, but still I'm not feeling it. So either way, just being real. So I go finally get over there after they're like, well, what's taking so long? La 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 la. All right. So I finally get over there. I said, how can I help you? Remind you, this is 9 o'clock in the morning. They proceed to open up like a long aluminum foil wrapped up like a pencil was wrapped up in there, or a single hot dog or something was wrapped up in it. They unfolded this aluminum foil, and it was a crack rock. Okay, so they wanted me to tell them, or they wanted me to. They asked me, "Is it still good to use? Can they still use it?" A crack rock, well, some crack rocks. And I understood what the problem was because it wasn't a really good rock. It was a little like, I would say, sludgy, but it just wasn't a fully formed crack rock. I'm a pharmacist, so I just happen to know. Anyway, besides the point. And so I was just so taken aback by that because it was 9 o'clock in the morning and they had the nerve to be complaining that it took me so long to come to them because they wanted quick customer service just to ask me about a crack rock. They weren't afraid of the police. They weren't afraid of, they just wanted to know. So I told them I think it was a little sludgy, but hey, whatever. This was before fentanyl was a big issue or whatever like that. So, and a lot of people ask me, well, why I didn't call the police or why I didn't, wasn't alarmed by this. And like I said, I'm working in an underprivileged, underserved community. So my nice way of saying the hood. And if you're bold enough to have a crack rock in a public place and asking a healthcare professional 9 o'clock in the morning, that means you will have zero problems once you do get out of jail, because you know they will, of harassing me on my way to the car every night. So that was something as a professional I had to, just kind of take a L on that one and just do the best I can with the device. So yeah, so that was one of my probably my number one favorite stories as a pharmacist. Yeah. So, but either way, Jessica, I'm not sure if you have any good stories. Teacher Chronicles say, wow, yeah. So yeah, so a lot of people think pharmacists are boring, or all we do is throw pills in a bottle or whatnot. But it's really a lot that goes behind it. It does take a lot of patience. We work under high stress, so when you have to be really um, into your information, you have to really be solid in your knowledge base. You have to be really solid, because the main thing is we want us to be accessible, we want to take care of you, and we want you out. That's the main thing, because that is what you want as a patient, as a customer, and that's what why we're here, and we're here to serve. So that's basically it. Like I said, this is the first episode. I am super excited. Like I said, the premise of this channel, we're going to break down healthcare disparities, or racial health disparities, because that's very important. And I really know that pharmacists can be a part of the breakdown of that which is a public health crisis. Racism is a public health crisis, and that's basically, it's nothing but racism or sexism or whatever ism that is dealing with healthcare. And because of the main issue of accessibility, that's why we can really help with this crisis. So I hope y'all are willing to follow me along with the journey. And this is gonna be very informative. It's gonna be great. I'm sorry, this is my first day. I'm a little, unnerved. But as it's a relationship, so as we keep going, we're gonna grow and we're gonna learn it for each other. And also, I'm gonna show y'all that pharmacists, we aren't boring. We are fun, right, Jessica? We can be pretty fun. and I made it clear I was going to have not too much fun, because everyone knows I like to have a lot of fun. So, um, so any questions or anything? Oh shoot! Oh, I'm sorry, having too much fun. Sorry about that. I was having too much fun too soon. All right. Sorry about that. That's the bad thing about lives. The beauty of it is I like how it just comes at you. So I'm here to answer questions, and I'm very pretty confident that whatever questions you ask, bring them to me. I got you. I've been doing this since I was 16 years old. So, it's going to be very few things that's going to surprise me. And I'll give you honest answers. Jessica, like I said, we work together. Excellent, excellent technician. I hated that she had to go. And I want to talk to you too, because we got out of touch, but I want to talk to you because something we'll go into later. Um, but yeah, I'm very into just giving the details. And like, for example, and this is my favorite too, for men, and I like to pick on men because first of all I love men, but second of all, y'all are really the ones that do not take care of yourselves like you should. Y'all really, really do not. And it's really sad to see even the young men these days that have like the high cholesterol, the that's not checked. The young men that walk around all buffed, going to the gym, looking great on the outside, but when they come to the pharmacy, I can see a different picture and outlook on that. I see that they actually, have the high cholesterol. So in a case like that, when I do consult them on their medication, I'm probing, I'm getting into what are your lifestyle change. You need a lifestyle change. Like, what are you eating? So what that you go to the gym, so what that that you're working, that you're working out the gym, so what that you're buff and you have a 12 pack or whatnot. But it doesn't matter, it's what's on the inside that counts, because you're young now, but it's going to show itself. So it's just so that's why I like to pick on the men, and I say that because I see more and more young men, they're getting Viagra. There's nothing wrong with getting Viagra or whatnot, but when you start seeing, the younger population group that need it because of simple ailments, because of poor lifestyle habits, that's when it's really troublesome to see. If you're in your 20s and you already have cholesterol, and sometimes it could be intrinsic, meaning it's just something that happens. But a lot of times, lifestyle modifications can be needed, and it's not easy. And but we are here to prod you along and just talk with you every month. You can talk to your pharmacist, and we can give you that advice on that. And if you do need Viagra, for example, the savings, like it's what, how much is it, Jessica? Like what, $200-300 for a 30-day supply? But a pharmacist knows how you can get it for 20 some dollars. Oh yeah. You can get your Viagra for no more than like $20 for a 30-day supply. So that's stuff that a lot of people would not know. But if you make a relationship with your pharmacist and ask them questions, we'll tell it to you. We don't have time not to hold back information. We have to get y'all in and out. So we're really good for that. And on a personal level, as your personal community online pharmacist, I am here for that. So I have high blood pressure. Is it okay not to take my meds sometimes? Um, to answer that question, Teacher Chronicles, first of all, not taking, I call it like a car. And I'm not sure if you're a man or woman, Teacher Chronicles, but I'll put it in a male perspective, more likely probably a woman, because men don't ask questions like that. Either way, sorry, it's the truth. It's like a car. Let's say you don't put oil or water in your car is still going to work fine for a period of time. But once that oil gets old or it runs out, or once that water runs out, or antifreeze or whatnot, what is going to happen? It's going to be a breakdown. It's going to be a choking out of your arteries in your body or in the car. So that's why it's important to be what we call adherent or compliant to your medication, especially blood pressure, especially diabetes. Another thing, it's something that you don't feel right out, but if you don't stay up with it, then it's going to be an issue, and it's going to show itself in a form with the high blood pressure. With the stroke, you can have a stroke. You can have a heart attack. It's just a lot of different things, and they call high blood pressure or hypertension the silent killer. They call hypertension or high blood pressure the silent killer. And they call it that for a reason, because by the time you find out what's wrong or whatnot, it's already too late. You already had an event when you could have just simply stay compliant with your medications and keep, and work. And what I mean by compliant, I mean stay regular on your medications. And then that's what we're here for. We're here to talk to you about that, make sure that any drug interactions with the other medications. A lot of times people use an excuse not to take their high blood pressure medications because, I can't take it at the same time every day. Just excuses not to take it every day. And I would simply say just get it in within the day. It doesn't have to be perfect, but you need to be compliant. You need to take your medication every day, or it will show itself. So, to answer your question, is it okay not to take my meds sometimes? Um, things happen and you may forget, or something may go wrong where you don't take it, but it's not something, a practice you want to do, because like it's like I said, like a car. If you don't get that oil change, or if you don't keep that antifreeze in it, what is going to happen? Your engine is going to lock up. That's just all to it. So that's why it's very important to stay compliant or adherent, or basically take your medications every single day. So, any other questions or anything before we head out? So, like I said, if you're watching the replay of this, Please leave a comment in the comment section. If you have any questions, please reach out to me. You're welcome. Please reach out to me on Facebook. I have a business Facebook page with a messenger where people are very good at asking me questions. I do have a website which is HIPAA protected. And when I say HIPAA protected, that means that your information will be safe and protected. So if you're really into that, of course, then I can just reach out to me, and I can we can do like an appointment and talk about your healthcare needs or recommendations at that point. So all right. Any other questions or anything? And that's what I'm here for. If y'all have questions, but I know this is the first episode. I'm excited. I just can't wait. And we're just going to have so many things to share. I'll be back tomorrow. So um, this is going to be a lot of different topics that we're going to do trending topics. Like I said, this is health month, heart health month. And a lot of with especially with black women, we just black people in general, we are very much underdiagnosed, sent home just to have an event or go back home to an event we already having. So it's just so important that we get on top of this issue of racial health disparities and address it, and know that the pharmacists, we as a profession, along with the pharmacy technicians and the whole pharmacy team, we are here, we are accessible. And is at this point, if you're listening to me, is no excuse to have the proper health, because we can definitely either be the front line and help you before things get progressively worse, or we can be more involved and give recommendations on seeing a doctor. Or once you go to the doctor, if cost is an issue, or if you just in general are afraid to take medications. A lot of people are afraid of taking medications. We can just give you the calming and the expertise that medications are to help you. And if you have any side effects or anything like that, we will be glad to talk with your doctor to get things changed, to make things accommodating so you are willing to have your best, healthiest self. So, with that being said, if any other questions, I think we're going to head out, and I'm going to be back tomorrow. So, any questions or anything? But I appreciate it. I appreciate Jessica. I haven't seen you in so long. I miss you so much. You're like number one, girl. Like, miss you so much. I mean, you were awesome. Can't wait to hear about what you're up to next, and how the baby and the hubby is doing. Thank you, Teacher Chronicles. I appreciate your questions and your support as well. Trash Can Waves, I appreciate you so much. You're my road dog. You're always there, and I appreciate you so much for coming on. And I just appreciate all of the support of getting this first episode and just the channel up and running. So I really want to appreciate the people that have been helping out and making this happen. So I really do. Do you have any good over the counter weight loss products? Yes, that's like probably my favorite thing. I always tell people, I always be real. I'm one of those pharmacists. I'm not gonna try to sell you something because I'm not getting a commission off of it. So I don't have a dog in the fight. Okay. I guess it helps my profit. We call it profit sharing. But anyway, that's besides the point. But when it comes to, I've tried them all because I'm lazy. I don't want to work out, and I still want to be snatched. But when it comes to overall weight loss medications, I don't really agree with it. You can do the hydroxy cut, but then you have to worry about, do you have high blood pressure or diabetes or thyroid issues? Ally, ALLI, that's a good one. I've used that one myself as well. But you're gonna have the greasy side effects of the greasy poop that is, especially for Valentine's, if you eat like a nice big steak and you taking an ally, it's going to show itself. And that's not really romantic. Okay. It comes out in like this, like a grease pizza grease looking orange, thing, and it comes out unexpectedly. Um, so whenever people, there's the green tea capsules, and I always tell people straight up, if you're not willing to drink plenty of water, if you're not into diet and exercise, don't even waste your time on any of those products. It's just really um, it is really a waste of money, to be honest with you. It's You're not going to get the desired results that you want. Like I said, pharmacists, we are here to save you money. To me, I think it's a waste of money, and it's just really a bunch of marketing hype. So, from me personally, I don't recommend dietary products because I don't see any use in them. The best diet products are the best way is lifestyle modification, meaning diet and exercise. And that's just all to it. I'm not sure if Jessica's still here. Do you have any recommendations or anything? But yeah, for my expertise, don't waste your time and don't waste your money. It's all about what you put in your mouth. You got to stop putting food in your mouth. You can even lose weight without exercise. It's 90% what you put in your mouth. So even if you use the hydroxycut, even if you use the ally and have a greasy bowel movement that's going to embarrass you, um, yeah, it's not going to give you the desire. You're not going to lose those 15, 30 pounds. Even when you get a prescription diet aid, it's only for a short term effect. So I just don't agree with that. So and when you're a good healthcare professional, you do not mind telling people the truth. So I'm not going to just tell you anything just to, just to push you along or something to make you happy. Sometimes professional advice is not what you want to hear, but it's what's best for you. And that's what we train for. We are trained to do what's best for you because we've seen the big picture. We've seen all the different types of patients. We've seen all the different kind of results. And we know what would be the best. And especially with me being a pharmacy since I was the age of 16, I've been a pharmacist since my 20s. I definitely have a handle on, being straight and honest and what would be best for you and what not be best for you. So, any other, and Jessica said she's agreed with me and she is like the bomb technician. So if she says it's cool too, if she signs off on it, then I know we on the same page. So any other questions? And with Jessica, she has a baby. And so a lot of times, with babies and stuff, with the cradle caps or the little skin rashes or the skin ailments and stuff like that, come to you. You can bring your baby to the pharmacist, and we help out with stuff like that. I've helped plenty of babies had the cradle cap, and they even gone to the doctor, and because the doctors are so busy, they really don't have the time to really zone in, especially when it comes to African American babies. And, we have the different hair textures and the different kind of, the way our hair grows out of our scalp and stuff like that. You have to be really um, evolved to know what kind of products to recommend or to look at the different culture ads that people bring to your pharmacy or to your life. It's like that's what I call a culture ad. So you just don't give a blanket statement or a blanket advice. So that's a benefit as well. Sometimes it's just I call it carrying wisdom. You can know a lot of different things and you can be on the top of what you know, but if you don't have that caring wisdom, if you don't really care, if you don't really look at that person like a family member, if you don't think of that person as your mother or your father or your significant other, your child, then you're not going to really give good advice. So it's very important as healthcare professionals to give caring, have care and have wisdom, but combine the two concepts together to have caring wisdom for our patients. So, and that's definitely something that I love to bring to the people that come to me for their recommendations or their advice. So, because I've been there, done it, I have some things went on myself, going to the doctor, and I've been getting some crappy advice sometimes. And if I didn't know how to direct the doctor to what's good for me, I probably would still have certain issues. So, from learning that from a personal aspect of how a doctor is brilliant, and it, like I said, pharmacists are the same way too. A lot of times we can be busy, or sometimes we just don't care. And but you always want to treat every patient like the first patient of the day. You want to give your best every single time. And when you're a good healthcare professional, that's what you do. You give that caring wisdom to that first patient, to that last patient, to that first customer, to that last customer. That's what you do every single time. So that's something that we can do and learn and grow with, especially with the topic of healthcare disparities, health disparities, how to just have that blanket, like the customer or the patient is your own family, and you treat them as such. So either way, well, I appreciate it. This has been awesome. I appreciate all of the support. And as we go along, we're just gonna get better and better. We're gonna get more involved. We're gonna get deep. We're gonna have questions. Nothing is, don't be shy. You can call in. If you want to muffle your voice, or if you want to pop up on the screen and we can discuss certain things, ask me anything and I will be glad to give my best expert advice. All right. So I appreciate y'all checking out As Pharmacist Tish. Y'all have a happy Valentine's Day and y'all take care. Bye bye.